Hello, everyone. We're so excited to welcome you to our live stream Anxiety, ADHD, and Midlife Therapist Tips for Relationships, which is a part of our new Mental Health Unscripted series that we're hoping to host more of. So if you like today's live stream, please let us know in the comments. Please give us a like and subscribe, and we'll try to do more of these. I am Andrea Womack. I lead content development at Psych Hub, and like I said, just really pleased to be able to provide this opportunity, this Q&A opportunity today with our clinical advisor, Madhuri Jha. So for the next 30 minutes or so, we're going to have a really great discussion, a really great conversation about relationships. But before I introduce Madhuri, a few logistics on my end. The chat is open. We invite you to add any questions that you might have there. We've got a few that we're going to go through to start, but please feel free to add your questions there. We're going to try to include them in the conversation. And we're also going to post a few poll questions, so be on the lookout for those. And as it goes with any kind of public chat, please don't include any detailed personal information. And please be sure to follow the YouTube community guidelines to maintain a safe and welcoming space for everybody here in the discussion today. One final quick note before we dive in. The information, like all of our information on our YouTube channel, is really for general learning and exploration and discussion today. It's not intended to be medical or mental health advice, but we know that everybody needs that advice sometimes and that professional support. So if you're experiencing mental health distress or you have questions about your own situation when it comes to relationships and mental health, please feel free or please reach out to a qualified professional to discuss your specific support needs. And we're going to share some information at the end of our conversation today about how you can do that with Psych Hub. So with that, I think we're all set. Yes, I'd love to introduce you to Madhuri Jha. Madhuri is a therapist and one of Psych Hub's clinical advisors. You've seen her on several of our previous videos about loneliness and self-care. And so really excited to welcome Madhuri today. So welcome, Madhuri. Tell us a little bit about what we're going to be talking about today.
Thank you, Andrea. I'm so happy to be here. Today, we're talking about relationships, particularly how mental health intersects with love. Whether you might be dating somebody who has ADHD, might be dealing with anxiety or grief or a tough event, or also understanding what it means for us to change in age. You know, what does it mean to start dating in midlife or post-divorce or later on in life, and how you can make that transition. And these are real challenges that affect all of us. If they're not affecting you now in your life, might affect you in your future, or might have been a part of your history in your past. So we want to break down ways people can take with them to recognize certain patterns, respond with empathy and love at their priority, and rebuild their connection with their partner. And I can also answer any questions live that come up. So if you've got a particular relationship situation that you might be curious about, you can drop it in our chat. We'll make sure we monitor that, and then we can learn how to support each other together.
Wonderful. Great. So it should be a really good discussion. So let's start with some overarching questions about relationships and mental health. I wonder, what are some tips for maintaining intimacy and connection when stress or mental health challenges are present?
Yeah, that's a question I get a lot, actually, from both couples and individuals I work with across all ages. I think there's a couple things, three in particular, that I think are tips that we can all always apply. And I would say that these actually also apply to familial relationships and friendships as well, okay. And then I think if we can set these as like standards that we do for ourselves, it can really set us up for success. So the first one is to ensure that you are regularly scheduling quality time to do things together that you enjoy. And that's not just shared interests, but like if your partner really loves going to concerts and it's something really meaningful for them, find intentional time to set up moments to be able to do that. Even if it's not something that you enjoy. But I think having these regularly scheduled moments really sets up habit forming that says this return to home or this return to this relationship is really important. The other is to always remain open to communicating and do your best to be present and active when you're listening to somebody. Sometimes when stress happens, we get on the defensive really quickly. And I think it's important that we demonstrate to our partners, like, I'm here to listen to you. I'm not here to judge you. And I'm going to refrain from jumping to problem solving before I really understand what it is that you're trying to say. Yeah, super hard, because you care about the person, right? You want to feel like you can help them in that moment. But the other thing is also to make sure that you are taking care of yourself. Schedule time to self-soothe and quiet your mind, whatever that looks like for you. Some people need just a little bit of time during their day individually to center, feel like they can bring their best selves to the environment. But that also helps you remain regulated for your partner. I think one thing people don't realize is relationships are often at risk to become what I call like a crutch. Like you might be leaning on this person to support you through certain things, and you can get used to that pretty easily. What I encourage people to be able to recognize is we should actually be able to stand on our own 2 feet and then feel enhanced by the relationship that we're in, that is providing an additional support that we can't provide for ourselves. So that self-soothing, like self-regulation time is hugely important to anybody to feel like you have those tools to be able to do that.
Thank you. All great tips. And I love the first one about kind of my takeaway from that was shared experiences are super important, and finding ways to connect with things that the other person loves is a really great opportunity for those shared experiences. So great tips there. I'm getting a note that we might be having a little bit of trouble with the chat, so please keep trying, and we'll see those as they come in, and hopefully that's all working for everybody now. So next question, kind of moving on from tips, let's talk about validating feelings and this kind of phenomenon of, like we talked about earlier, problem solving and wanting to fix a person, especially or behaviors, especially related to mental health. So how can partners validate feelings and without feeling responsible for, fixing somebody or fixing behaviors or things like that?
Yeah, I think a phrase that I've also personally attached to is how to lead with curiosity. So become curious about the issue and what your partner is trying to say to you. Ask questions to seek clarity. Like Andrea, if you and I are having a conversation and you're trying to tell me a hard thing, I might say, can you help me better understand what you meant by that word you used, or that feeling that you had? I think it's also really important to say back to the person what it is that you heard, to acknowledge, like, I'm hearing that it sounds like you feel really frustrated, or it sounds like you're feeling really stressed at work, or whatever's coming up for you. Before, like I said previously, you jump to offer solutions pretty quickly. I think what we don't realize is, like, when we're really in sync with someone, we can also mimic their emotions in real time. So if someone's feeling anxious about having a tough conversation, we may also increase our heart rate to meet them there. And so part of our responsibility to support that person is to soothe ourselves, calm down, and kind of bring them down with us. So those are, 2 quickies that I think people can really attach to, is to learn how to ask questions, to seek clarity on the intent, and then also to really acknowledge what the person is saying. The last thing I'll say is to lean into also using I statements, rather than saying, first and foremost, you did this thing that really bothered me. To rephrase that and say, I felt a certain type of way when this thing happened, because what that can immediately do is not put the person on a defense mode, if they're receiving criticism or feedback, and also acknowledge that there was an emotional reaction that you had that needs to be taken care of.
And that's a great, some of your points there are a great segue into anxiety, kind of how we're feeling and maybe feeding off of the other person's energy. Let's talk about anxiety. So what role does anxiety play in relationship dynamics, and how can that be recognized early?
So I will say one thing that's a foundation in psychology that I've not really had a lot of cases in my experience, or even personally, that isn't true, is that we tend to find people attractive who remind us of our childhood. Sometimes that's our parents, sometimes that's a sibling, sometimes that's like another adult that you had some kind of an attachment or an affinity for better or worse. And I say for better or worse because anxiety in a relationship can mean that you're internalizing a feeling that the stakes are really high to maybe remedy or kind of create a situation that you had at a previous stage in your life. What that can do is create an overdependence on the relationship. It can result in kind of controlling behavior, feeling like you need to set a certain outcome to happen between you and that person. Really needing reassurance from your partner, like, are we okay? Are you going to leave me? Are you going to abandon me? And those are usually from wounds that we haven't really resolved internally. And that can be really frustrating. That can also result in emotional distancing. And so I think it's important to recognize those signs. And some of the early signs of that are things like seeking constant validation, like me saying to you, I really need you to tell me that I look really good today. Can you tell me that again tomorrow? I really need to be validated in that way. It can also look like a fear of abandonment, like, are you going to leave me if I don't do this thing, or I don't pick up this thing at the grocery store? The other kind of sort of hard feelings can be excessive jealousy, like concern about what you're doing with your time. Who are you spending it with? Why are you giving somebody attention more than I can? I will say, for families I've worked with, when there's young children that have been introduced into the family, that's something that can sometimes show up that people don't even realize, is that the kid is getting attention, actually, that the partner was really used to being able to have. And so recognizing that pretty quickly can help quell that anxiety. The last thing I'll say is you can be at risk for misinterpreting really small issues as signs of a major problem. Like, oh, you keep forgetting to pick up this one thing I keep asking you to pick up at the store. Does that mean that you don't love me anymore? Like, those kind of cognitive distortions, I think, can be really wrought for risk of increasing when you don't recognize that there's just an anxiety permeating that someone needs to be validated and recognize that they're having.
Yeah, and thank you. I think that last insight really segues nicely into another area where those kinds of fine details or behaviors may be misinterpreted or cause a lot of frustration, and that's ADHD. So a lot of couples might deal with frustration of missed details or plans or feeling unheard, and it might be symptoms actually getting in the way and not necessarily the connection. So what do you see as some of the biggest communication pitfalls when ADHD is a part of the picture?
Yeah. And for anyone listening, ADHD is attention deficit hyperactivity disorder. It's a communication disorder. It's a processing disorder. It is not something everybody has. I know we kind of throw around ADHD socially now, but it's very specific to people who have it. And where it shows up are in challenges with things like focus, being able to sustain attention, procrastination, things like that. So what I want to break down is really what that means in a relationship. So with focus, right, if I might have ADHD, I might have difficulty focusing on tasks and being able to complete them in one sitting. That can lead, or kind of also in a conversation, right? Like, I can have a hard time focusing on a conversation and not getting distracted. What that can lead to, if the person doesn't have an understanding that's stemming from ADHD, is that the conversation goes off track. It can feel like there's kind of intentional interruption, or like a lack of desire of wanting to pay attention. Someone could feel like, oh, you don't really care about this issue because you're not able to focus on the conversation or sustain yourself in it. That's not what that person's actually trying to communicate. So I think that that's one pitfall that comes to mind. The other thing that comes up with ADHD often is forgetfulness or procrastination. And so in a relationship, that can create some challenges where a partner may feel unheard. Like I said, like, you keep forgetting to pick up this one thing at a store, can start to feel really personal and intentional rather than a function of the symptoms that person's having. Or that their concerns are not a priority. You could say, oh, Andrea, I forgot that you actually said that. But it meant a lot to you for you to communicate this thing. And so again, it can feel like that was intended. The last thing that's unique to ADHD is what's called rejection sensitivity. So, when you experience like, no, I don't like what you did, because I think folks with ADHD are so sensitive to an awareness that they have, that they have to communicate differently, or they have to kind of orient to the world differently. You can be heightened risk for sensitivity to rejection. If someone says to you, because you did this thing, it made me feel really, really bad. It can set up a tough feedback loop, to create misunderstanding. Like, I'm really not intending to procrastinate this much. It's just something going on in my brain chemistry that I can't control. Hope that makes sense. But those are things that come to mind of ADHD and relationships in particular.
It does. It makes a lot of sense. And thank you for breaking that down. One of our questions has to do with kind of, you described maybe, things that aren't intentional feel really personal. So how can couples break the cycle of possible resentment and even scorekeeping around ADHD?
Yeah, like scorekeeping is such an icky word, right? You don't want to feel like you're competitive, but I think when you don't understand what's going on with your partner, if they have ADHD, this can really happen. The first thing I'd say is to kind of shift to what I would call like a mindset of generosity. Sometimes it can be like saying like, is there a way that I can actually help you navigate this situation?
Yeah.
A lot of folks with ADHD who've been diagnosed and kind of working through that for a while are very aware of what they need, to help them function at a level that they feel matches people who don't have ADHD. So asking for those things is really important to understand how someone works. For example, some people really benefit from creating lists to be able to help them understand what they have to do during the day. Sharing that with your partner can be really helpful because they can know, how to support you to be able to do those things and what interruptions to avoid, to make sure that you can maintain your focus throughout the day. I think the other thing I would say then is like communicating your needs clearly without blaming someone, right? So that would sound like the bad way would be like, because you have ADHD, you keep forgetting me in this way. And so it makes me feel really, really bad.
Mm-hmm.
I don't want to blame you for this thing that you can help, right? But I do want to acknowledge my own feelings. And so you can say it like, I really understand that this is something that you're working on. How can I help you work on this or better understand what you need? Because if I don't feel like I'm a part of it, I'm feeling like I'm being left out of the process. And that really hurts my feelings, right? So it's like kind of shifting what that means.
Yeah.
That brings me to what it means to have team-based solutions, right? So if I win, you win, right? Like if you win, I win. And creating a mindset where you can join each other in those processes can be helpful, especially if not both partners have ADHD, right? So one is really learning how to adjust, but then also gives an awareness of the person, again, back to rejection sensitivity. Like if they do something, you've got a clear understanding, like the outcome benefits both people. If I have this space and time to do this in a way that my brain attaches to the most. And I think that can just help build trust and empathy. You can build perspective and like a sense of understanding of what someone's going through. And it's hard to not feel like it's personal if you don't have an orientation to it. So definitely seek out the help of a professional as well. If you feel like you just need some like psychoeducation, there's some really amazing also short resources on Psych Hub's platform. I know about just what is ADHD and how does it show up, like check that out and inform yourself on it. It can be really helpful.
Yeah, that's really great. And I really appreciate the examples. Like this is maybe not how not to say it and how to try to say it. I love those practical examples. So you've given us a few, so kind of a little, pivot into some more practical examples or tools. So are there some tools that couples can use to improve organization, follow through, or emotional regulation?
Yeah, definitely. So we'll do all three. Let's actually find a way to apply something for all three. So let's start with organization. I think the idea of shared to-do lists and calendars is like a really foundational, easy thing you can do. Let your partner
live by ours. Yeah.
Right? Yeah, exactly. Like let your partner know what your to-do list is. Yeah. Share them together. See if there's any facets of your day-to-day schedule that would impede somebody being able to do their to-do list. I know how I feel when I know that there's stuff that I just really have to accomplish and I don't get it done at the end of the day. And it's even harder when I feel like humans are interfering my ability to do that. So I think if you can share your to-do list, also sharing your calendar, knowing sort of what's on the schedule, but that also helps you understand like what's a priority for your partner. Like, for example, if there's certain exercise classes or a routine that somebody is very important to them to follow, how you can help them is by adding it to your calendar to know, okay, at this hour, every Wednesday morning, I'm not going to bother Andrea because it's really important that Andrea has that space and time to go to the gym, right? And doesn't feel like you're taking away from it. For follow through, I think This is helpful also if you have children, but regular check-ins and updates, being instituted into your daily practice is a great way to just like ensure you're communicating. Okay, so how are things? Like, how that thing you wanted to accomplish last week, were you able to do it? Like, how did that go? I think the end of the day or at like a dinner table or just like a final phone call in the evening that you have with someone is a great way to create a practice for that. Alternatively, in the morning, setting up an intentional time. I just talked to a couple about that actually earlier today, is like, how can you have a set time in the morning where you're just like, yeah, okay, so what's up? Like, what's going on? How are these things that you really wanted to work on? So that person knows that you're paying attention to them. You're giving them awareness about it.
Yeah.
For emotional regulation, I think there's a couple things that I think are really helpful. One is to consider shared safe words to help you take what I call like an emotional timeout.
Okay.
So like if you are getting into a situation where it's feeling heightened or heated, sometimes you just need to take a timeout before you continue the conversation.
Yeah.
That can literally look like doing like a referee timeout. Hey, okay,
Love it.
right?
Yeah.
The Gottmans recommend, 20 minutes actually to help you
Okay.
regulate before you come back to the conversation. I think that's a really healthy thing you can do. The other thing you can explore is like, if you've got like an inside joke, there's like a cheeky word or something that makes you both giggle, let that become your safe word, So it's like, I'm having a heated conversation with you, Andrea, and the cheeky word is Psych Hub. And you're like,
Okay.
Psych Hub. I'm like, oh, okay, yeah, I know what's going on here. This is our
I
moment
know.
for us to say, like, we got to take a beat. But I think also ensuring that you're seeking joy intentionally as much as you can as well. Right. So it kind of goes back to what we said earlier, like doing joyful activities together, where you're both like kind of co-soothing in real time, or you're feeling like you're enjoying something together, kind of sets your heart rate to feel in sync and be able to manage that, and also have something to look forward to. Which is coupled with ensuring that there's space for independent wellness and regulation as well, right? To kind of prevent codependence, it means that you've got to be independent still in your relationship. So are you taking time to do the things that you enjoy, that soothe your nervous system, that make you feel good? And is your partner aware that those things are important to you, right? And that, that's not like a reflection that I don't want to spend time with you because, walking every morning is important to me. It's showing them it makes me a better partner if I have time to be able to do that.
Yeah. That makes a lot of sense. We've got I'm checking on the chat. We've got our first poll in the chat. Thank you for everybody who's answered that question. Love the participation and the engagement. So good opportunity to transition into our third subject area. So midlife. So let's talk about, getting older adults. Things change throughout the lifespan of an individual. So we wanted to spend a little bit of time talking about relationships in midlife and older life. So tell us about some things that older adults are facing when it comes to navigating new or changing partner relationships later in life.
Yeah. I think the one thing I want to just call in is I think socially we don't support the needs of older adults enough. Like I think in general, we can all do a better job of not stigmatizing someone who might be finally ready to date after being, having going through a divorce or becoming a widow. And, like like everybody's deserving of companionship is my point. And I think there's a better way we can normalize that. But I think, if you are someone later in life or, midlife or beyond, we've all been through stuff already, more often than not, it's like you've been through some breakups, you maybe have had a difficult loss, you've gone through some trials and tribulations. And so you have to be aware that trust building can require slower movement, more intentional communication in the early stages, not sort of the quick spark of a honeymoon that you feel like you're in your 20s, taking some time to intentionally understand where someone's coming from. I think there also needs to be acknowledgement of physical changes people go through. I think for women, menopause impacts things like your sex drive and your ability to feel connected to others. There's like science behind that. Same goes for men. Men go through physical changes as well. And I think acknowledgement of that is important because you don't want to shame someone on the type of activities they can and cannot pursue as a result of those things. it's not a reflection of what they can't do or don't want to do. It's sometimes a reflection of what they just physically aren't able to anymore. I think also planning for the last phases of life is very different than planning for what it means like building a life with someone, right?
Yeah.
And dating with intention in the second half of life, those questions may be more related to like, what are your shared plans for the future? What are your shared understanding of how you spend your assets that you've accumulated if you have them, or like where you imagine retirement to be, and do you have those things in common? Some people, let's say like you might be someone in when you're in a more stable part of your life, you may want to like not live anywhere and kind of be a citizen of the world and kind of travel and do all these things, whereas other folks may be seeking more quiet, more respite, more kind of isolated place where they'd like to be. So those are very different interests, right, of how you want to spend your time. So I think more and more people are looking less for kind of complementary opposites and more for people who actually match those interests so that you can join you in those experiences.
Yep, that makes a lot of sense. All of your life leading up to that moment has informed what you're feeling, doing, and thinking and wanting now. So that might look very different than your early years, or it could be things that have brought you stability through your entire life that you want to keep in your life. So kind of thinking about mid and older life and maybe some of the stages and kind of things that are on top of mind, including reflecting on life. And one of the articles that we published this month that is free on our website is about the intersection of depression in midlife and midlife crisis. So I'm curious if you can talk a little bit about some of the signs that we might differentiate between what a midlife crisis looks like and then what is depression that may need professional support.
Totally. Which, I will say I am around the age of 40 years old and I may or may not be having one myself. So I think these are just like common things to occur, right? Of like, it's not necessarily a crisis, but it's not uncommon that you feel a little dissatisfied. You can feel dissatisfied or not content with the way things are and you're seeking some change. You want to understand, like, are there things I haven't had an opportunity to do that I want to? So I'll kind of walk through sort of what I call maybe symptoms of like a midlife crisis or an existential questioning versus like when it's, what does it look like to be depressed? So, if your state of discontentment starts to look like persistent sadness, like shame or insecurity, it's probably an indicator that you're depressed, that this is no longer like an existential questioning, that you're actually dealing with depression.
Okay.
Same goes if your desire for new activities or interests, like, oh, I've never really traveled to this brand new place, I'm really interested in it, starts to feel like a total lack of pleasure in the things that you used to enjoy. Like, I don't like anything that I used to do. Everything is really hard for me. It's a sign that you might be at risk for depression. A lot of times in a midlife crisis, we hear people say, I have a loss of energy or stamina for certain things. I just don't have the energy or bandwidth for it anymore. If that starts to look like really persistent fatigue, like distorted sleep patterns, your appetite goes out of whack, those are symptoms of depression now. Those aren't just you saying like, I don't really have the bandwidth to do certain activities anymore. The last thing I'd say is, midlife questioning could look like exploration or curiosity about what other people do, So like, oh, Andrea, you have this thing I've never done before. It's piquing my interest. I might want to try that now. I've never done it. I'm a little nervous. Risk for depression might be that you internalize a feeling of sense of bad self-worth, that there's hopelessness or social anxiety, or like you have something that I don't, feelings of persistent deficiency. Those are indicators that it's becoming depression. So I think there's like subtle differences, but you can start to notice how they are.
Okay, that's great. And I know we're almost at time. But before we wrap up, wanted to transition into when you are noticing that, or maybe feeling that professional support might be needed. What should couples consider around therapy, coaching, for any of the conditions that we talked about, or just in general?
Yeah, absolutely. The first thing I want to say is like, there's an interesting observation that I am making post-COVID, particularly I think in younger couples, where because periods like college or post high school and starting a new job are often where we kind of take these risks of how do I resolve a conflict or how do I tell someone a hard thing and learn how to
Mhm.
communicate it. A lot of those folks didn't have those years. So one thing we're starting to see,
Oh,
a lot of therapists I've talked to are that, folks are unaware of how to resolve conflict. Conflict is normal in a relationship. More often than not, after the first 3 to 6 months you're with someone, you start to relax a little bit and certain parts of your personality may come forward. So there's a difference between having one or two bad fights versus patterns. Like
okay.
if you start to have a repetitive argument, the same thing keeps coming up, or the same thing that person's doing to bother you keeps happening, you might need some professional support to help mediate that. You can start to feel stuck. You can start to feel like it's been months of the same kind of pattern. Those are signs that you could benefit from an objective person helping you sort through, like, why is this happening? Why can't you do that? The risk for resentment and animosity towards the other person can also result in emotional distancing. So, one big indicator that you might need help is the intimacy goes down. A lot of couples will
Okay.
come to couples therapy because they haven't had sex in a really long time. And they're acutely aware that there's resentment or there's tension or there's just a feeling of like othering going on that's preventing them from doing that. Those are signs that it can happen. There's lots of life transitions that can sort of be risk for that. You can get help to sort through that and figure out what can work for you to rebuild that connection. The last thing I'll say is like, sometimes when you're having a hard time with your partner and it goes unaddressed for a really long time, you can be at risk for eroding trust with that individual.
Okay.
So if you're starting to feel like you want to do something impulsive without the permission of your partner, that can go from infidelity, right? Your eyes are wandering and you're saying, oh, I'm going to act on this thing. Or let's say maybe you want to make a big purchase and you don't want to tell your partner about it. That means that there's something that you're feeling like you can't vocalize in your relationship, and that action of acting out is how you need to address it. They're
Okay.
all signs that the help of an objective mediator could benefit. How can you communicate the discord that's happening with your partner? I think a lot of people take things like cheating, so one-sidedly, and more often than not, there's been a breakdown between both people, but there weren't the tools and resources to communicate sort of what was happening or the hurt feelings that the person had. And so they do make a cowardly decision to go seek it out elsewhere. It's not a good thing at all. But I think that there's ways that you can recognize that you're at risk for it and prevent it from happening so you don't hurt the person that you care about, or do something that you
Sure.
will just regret, and then it becomes very hard to recover from.
Yeah, that's a really good point. And it sometimes it might feel scary to dive in and try to uncover those underlying causes, but always, always well worth it. It is hard work many times, but always well worth it. And with that, I do want to remind folks that Psych Hub is a place where you can come and find that support. You can go to psychhub.com and explore all of the different kind of providers and care opportunities that we have on our marketplace. So feel free to check that out. As we mentioned earlier, we have tons and tons of free resources on our YouTube channel, as well as on our website. Go to articles and resources, and we have information about everything from depression, ADHD, relationships, children's mental health. So almost anything that you're looking for and want to dive into is on our website or on our YouTube channel. Thank you so much for your time today. Thank you everyone for joining us. Thank you, Madhuri, for all of the wonderful information that you've shared with us about ADHD, depression, anxiety, midlife, and how to communicate and how to really give ourselves and our relationships the intention and the love and care and connection that they deserve. So thank you, everyone. We hope to do more of these. Tell us if you want more of these in the comments, and we'll try to make that happen. So everybody be well. Thank you so much for your time today.
Thank you.